You're not crazy. This is my 4-phase process to actually avoid a hip replacement. And the reason why I say you're not crazy is because most people who have hip arthritis are told that they're eventually going to need a hip replacement surgery. And if they're not going down that path eventually, they're seen as crazy for doing something different, for doing an alternative treatment, which is what I'm telling people to do because I see it be a productive thing for them consistently. They successfully avoid a hip replacement surgery. Let me first tell you the typical progression of hip pain and how it turns into a hip replacement eventually. So here on this graph, we have ages starting in your 40s, 50s, 60s, 70s, and 80s. And hip pain usually starts somewhere in the 40s and it starts to climb up like this. And there's things that set it off more, like you had a bad fall, you exercised inappropriately, and that made it worse. And people kind of step up in their hip pain to eventually they hit a landmark moment where they get diagnosed with hip arthritis. So we'll call this hip OA. And at this point, they usually get told, depending on how severe it is, you're going to eventually need a hip replacement, some sooner than others. But the problem just tends to get worse, and that's what surgeons are typically seeing. That's why they'll say this comment, and then they'll have a hip replacement. So that's called a THA, a total hip arthroplasty or hip replacement. And then even after the hip replacement, they still kind of get worse in pain. It just gets worse and worse as time goes on. And the reason why is because there's a muscle imbalance that has not been addressed, that even though the ball and socket joint is replaced, people still have pain for other reasons. And you can see more of my videos to get more details on that. But let me draw another line that correlates with this. It's called an inverse correlation, meaning as this line goes up, the other one's going to go down. Now this one's about glute strength. So glute strength is usually high in your younger years, and as we sit for longer periods of time in school, in college maybe, in working likely, after working in retirement, sitting just happens, especially in our culture in the United States. And so glute strength gradually goes down, and with these injuries, it goes down even more. And by the time you get to hip OA, hip osteoarthritis, and then have a hip arthroplasty, a joint replacement surgery, glute strength just goes downhill. That's why you see people in their later years of life and they have no butts. It's kind of a joking thing, but it's a big muscle imbalance that happens where people get no muscle back here and they get a lot of muscle back here, or even the hamstring muscles behind the thighs. These muscles become overdeveloped in the low back and in the back of the thigh because they're compensating for weakness back here. And when you have that muscle imbalance there, that's what leads to bad forces going through the hip joint and makes your hip arthritis and your pain in your hip worse. Now, what we do in our treatment approach is break this graph by changing the process. So as hip arthritis or hip pain comes on and eventually turns into hip arthritis, about that point where people get hip arthritis, the diagnosis, that's where they end up finding us usually. And what we do with their glute strength, I talk about glute strength because it's the main one that we focus on. There's other ones though. But if glute strength is up here and it's diminishing, it's declining, we make sure that they get stronger in their glutes. And as they get stronger over time, what we see is, right here where they got the hip osteoarthritis diagnosis, it starts to decline and go down. The pain, this is hip pain right here. And we want to keep it down as time goes on. As long as you know what to do to maintain your hip strength, then you should have no hip pain, even though you have clinical arthritis, even if your hip joint is bone on the x-ray. And the surgeon told you you're going to need a hip replacement eventually. If you can keep your glute strength up and even go up higher than that, then you have an even better shot at making sure that your hip pain is down despite you having a hip arthritis diagnosis. There are people that have no pain that if you took an x-ray of their hip, they have arthritis. That's important to realize, that just because your x-ray shows you have arthritis, it doesn't mean that you're going to have a painful hip, and it doesn't mean that you can't do stuff. You can be just fine despite your bones looking a little bit arthritic in the x-ray. So now let me explain the 4-phase process that we take our patients through that are seeing us here in person, and then our clients that are working with us online in the hip arthritis recovery program. So in phase 1, we're focused on making sure that you're getting the pain down and making sure that you're sleeping better. Sleep goes up. Sleep time, sleep quality, and then also making sure that your mobility is going up. So in other words, that you can, mobility, sorry, I'm not great at spelling, that all these things improve. Because at the very beginning, you're just worried about trying to not hurt, trying to make sure that you can get rest. Sleep's really important because that's when you do the most healing. Getting the pain down just makes life easier. And getting some mobility back because you're likely feeling stiff, that's going to make your hip feel a lot better. That's all phase 1 is concerned with. In phase 2, now we're worried about increasing the mobility even more. So mobility goes like maximizing it so that we can really make sure that you're feeling amazing. Turning on muscles. I'm just going to write MM for muscles. Muscles that have not been active, muscles that are weakest and that you need to improve so that your muscle imbalance can begin to be shifted. Oftentimes in the muscle imbalance, the glute muscles, like I was talking about in the other graphs, they're not even active. You can't even fire them. And the way you can test this right now is if you just, in standing, like I'm standing right now, whether you're sitting, standing, lying down, whatever position you're in, if you just try to tighten up your butt muscles, if you make these muscles stiff and tight back here, if you feel your thigh muscles also work, or your back muscles and your lower back also work, and maybe not even your glute muscles working at all, your muscles back here aren't working, then you have this imbalance. And this activity in phase 2 of getting your glute muscles to activate is critical. For most people, that's all they're starting out with. Forget strengthening. We're not strengthening, we're just activating. We're turning on the muscle so that you can turn on the muscle consciously. So you can tell your muscle to work when you need it to work. Because right now, subconsciously, you're probably not doing that. You're going to go walk, you're getting up in and out of chairs, you're doing exercises potentially with the intent of healing your hip arthritis, but you're using the wrong muscles because all this is happening subconsciously. You need to gain conscious control over those glutes. And getting that conscious control over the glutes is going to allow you to walk better. This is a huge one because people need to increase the amount of walking they're doing eventually just to do normal life without hurting, to be able to cook a meal, to be able to do your chores. And so getting the right muscles to turn on and then getting them to turn on at the right time, during timing, because every time you take a step, there's a right time where your glutes should fire, and you need to be consciously aware of it. A lot of people think that they just know how to walk, and they laugh at us when we tell them, let me teach you how to walk again using the right muscles. And as they go through it, then they start to realize, oh, I'm not doing that. And I can see why it's hurting my hip and making my hip arthritis worse. And no physical therapist told me this, a surgeon didn't mention this. It's no wonder why they're saying, yeah, I'll see you in 5 years when you'll need the hip replacement. We'll see how long you last, see if you can make it 2 years, and then come in. But if you can figure out these things, you don't need to be there. And this process, just going through phase 1 and phase 2, will take you roughly 90 days, 3 months. Some people less, some people a little bit more, but that's on the higher end of what we've seen for the average. Some people are doing it in 2 months even, very consistently. At this point, when you finish phase 2, people are feeling good. People feel that they're over their hip arthritis problem. They still have pain here and there. There's still activities that hurt them, like if you do too much, if you walk too much, if you stand too much. If a holiday comes around and you're cooking more than normal, or you're more active with your family or with exercise more, then it will flare up. So in my eyes, you're not done. That's why we still have phase 3 and phase 4. And in phase 3, what we're focused on now is increasing strength in those weak muscles, usually the glutes. So remember, over here, we're just turning on the muscle, not focused on strength. It's going to happen anyway, but here we're really focusing on strength. Weights need to be lifted. The muscle needs to get tired. You need to get fatigued in order to make sure that that muscle's improving its strength. It might even grow. You might even get thicker glutes, which isn't a bad thing for most people. and thicker in the right ways. You're getting muscle. If you can get that increased strength, now you're building a buffer of strength to protect your hip joint against hip arthritis. That's where we see this deflection point where you're right in here is where we're just turning on the muscles. At the bottom right here is where people feel really, really good. They're like, oh wow, I have the ability to fire my muscles. Now we're turning this deflection point. The pain's actually coming down instead of going up. And then here with the glute strength, as we get stronger and stronger, the pain just goes farther and farther away, and you can tolerate more activities without flaring up your hip joints. That's what we're working on here in phase 3. The strengthening is critically important. That's going to allow you to tolerate more activities. So people often get into little flare-ups here in phase 3 because they say, oh, I'm feeling so good, so I went hiking. And then afterwards, I had to pay for it for a day or two. And I like for people to test out their limit, but be wise, be responsible, make sure you're not going to hurt yourself. But at the same time, very cool that you're able to do that whole hike now instead of a part of a hike, or even just attempt a hike and do some of it, because before you didn't even dream of that because you knew it was going to mess up your hip. What a great place to be in. What an excellent decision to have to make. Whereas before you were thinking of having a hip replacement surgery. Great place to be. And then in addition to that, related to it is increasing your endurance in your hip joint. So for some people, being able to get on a treadmill and walk for 20 minutes or 30 or beyond, use an elliptical, use a bicycle if it's right for you. Some people, I tell them not to use a bicycle because you're using the wrong muscles. Rower, swimming, anything where you're on your feet and moving your muscles for a consistent amount of time, it is important because your hip joint has cartilage lining on the inside, and cartilage lining is designed to take endurance activity, to take consistent activity over time. It is actually stimulating healing the more you do some endurance work. You have to work within the tolerance of what the cartilage could take without flaring it up. There's limits, in other words, but as you work on that, as you do bouts of exercise, that tolerance increases, and whereas you can only tolerate 20, 30 minutes at the beginning, eventually you can get to an hour and beyond. And once you're confident that you can do most of these activities, 90% of what you would normally do or better, then that's usually when you can move into phase 4. And we have specific criteria that you can find in the program that fits you into these phases, and there's specific exercises and specific treatments to do in each of these phases. That's why this is so important, because if you are in phase 1, if you qualify to be in phase 1, but you're doing the activities, the strengthening and endurance activities of phase 3, you're going to make it worse. You have no business doing phase 2, 3, or 4 activities if you qualify in phase 1. And vice versa, if you're in phase 3, you're feeling good, but you're stuck on phase 1 activities, it's not going to help you much. Probably isn't going to hurt you a ton either, but you're not going to progress to your maximum potential here if you're stuck doing the activities over here. That's what often happens. This is stuff like icing and taking pain medication and going to go get injections. And that might be necessary for you in phase 1, but if you're doing all right, you're improving, you need to move into the right activities, and that's why we have this 4-phase system. Now out in phase 4, this is the maintenance phase for everybody, and so here we're maintaining and still improving if possible. Maintenance. Sorry, I'm spelling bad, I know there's errors. We're working on strength, just gonna write STR, and we're working on improving endurance. What you don't want to do is back off on exercising. So incredibly important. And this is why I think this program, the Hip Arthritis Recovery Program, which I have all these phases built out, there's a community of people, there's live coaching you can do in our program to make sure that you march through the phases. But this program isn't for everybody, because it takes commitment to get through these. A lot of people get into this area with normal healthcare, phase 2, and then they drop off because that's how long normal healthcare lasts. If you go to physical therapy, you're in there for 2 or 3 months, and you might feel a little bit better. You might get to the point where you're like, oh, I'm done. And as soon as you don't have any symptoms, they're willing to say, hey, this worked out, we're done, resume life as normal. Meanwhile, you never do the actual strengthening, endurance, all this stuff over here that gives you the true long-term benefit and allows you to have your glute strength graph look like this and your pain graph look like this. Instead, if you're stopping at phase 2, then what really happens is maybe you get a flat line right here where it doesn't get worse. Maybe it will dip a little bit, but if you never work on your glute strength long term, it declines, then your long-term hip pain line is going to look like this. You have to go into that phase 3 and phase 4 section, and the length of time that it takes to be out here in phase 3 and phase 4 is about another 90 days for most people, but a little bit more often. So this whole process can take 180 days on the average, or 6 months, to heal hip arthritis enough to where you feel confident that you don't need a hip replacement surgery. Most people don't last the full 6 months. They go for 2 or 3 months with the treatment approach, hoping that that'll fix a decade's worth of problems. But they're not seeing the full picture. And part of it is because healthcare professionals don't understand this either. And so they're thinking, oh, this hyaluronic acid injection is going to fix your stem cells are going to fix your hip arthritis. And it should last a few months of treatment in order for you to get the full outcome. But that's not the case. We have to take care of the mechanical issue, the strength problem, the endurance problem, the conscious ability to fire muscles, the timing of when to walk. It's a whole process that needs to happen over time so that you can successfully heal your hip arthritis and make sure that you're not going to have a hip replacement surgery. I'm not crazy, and neither are you. And if you believe this is possible for you, this is doable. And you'll see improvements along the way. It's not like you're going to be debilitated for 180 days and then see success. Most people are feeling gradually better, doing a little bit more. And by the time they're over here, people are like, wow, you're so much better. Oh my gosh, I can't believe they said you needed surgery 6 months ago. You're feeling fantastic. If you want to learn more about our hip arthritis recovery program, check out the link in the description below. You get all the details about the curriculum part, which is going into all the phases here. There's videos of me teaching you how to put yourself in a phase, what treatments to do in each phase, how to know when you should move from one phase to the other. All that's detailed for you in the curriculum part of the program. Then we have coaching, live coaching. We have weekly live coaching calls with myself and my team. We're walking you through the phases to make sure that you don't get stuck. And then there's also an exclusive community of other people that are on the same journey of you as trying to recover from their hip arthritis and avoid a hip replacement surgery. And there's my team and I are in there cheering you on, making sure that you're on the right track. Go check out all those details in the link in the description for the hip arthritis recovery program. Thanks so much for watching. Hey, if you want to learn more about the root cause of hip arthritis that nobody's talking about, check out this video right here.